As a family doctor and AAFP member myself, it is so refreshing to hear about how the AAFP is passionate about optimizing the lives of family doctors all over the country. Now, coming to the stage, we have the husband and wife team at Halcyon Health, Dr. Emilie Scott and Dr. James Gaor, who celebrated their 5th DPC anniversary earlier this year. They are joined by Carlos Reines, president and co-founder of Rubicon MD, who will interview them and talk to them about ways Halcyon Health DPC has successfully brought specialist care into their DPC practice and how it has helped with growth, retention, patient satisfaction, quality, and outcomes. Great to have you all here.
Thanks.
Thanks.
Thanks so much for having us. We're excited to participate today. I'll just dive in real quick with a quick background on myself. So as Mariel said, I'm Carlos Reines, president and co-founder of Rubicon MD, company whose mission is to democratize access to medical expertise and to do so by supporting primary care clinicians at the point of care. We've talked about many times about the lack of investment, but what about the lack of innovation for primary care clinicians when we know that every well-functioning healthcare system in the world relies on a solid foundation of primary care? For me and my co-founder, starting this company was personal. We both suffered the challenges associated with lack of access to specialty care. In my case, I had an accident when I was a kid. I ended up losing vision because my clinicians didn't have access to that expertise. In the case of my co-founder, Gil, there's a situation with his grandmother who had to travel back and forth for post-op care after a brain tumor. And we decided to tackle this by putting primary care clinicians at the center. So I could not be more excited to have a conversation today with two of the clinicians that I admire the most, true innovators. They've built an incredible practice and grown it over the years. So maybe let's start. The topic of today is integrating specialty care into your practice. Let's start by asking you guys, tell us a bit more about the practice and what kind of specialty care needs do your patients have?
Thanks, Carlos. So my name's Emilie Scott. I'm a family doctor, and I'll tell you a little bit about Halcyon. We started here almost 6 years ago now. I was in kind of corporate family medicine, prior to that in academics. And now here we are, we have 3 of us practicing and we have about 1,100 patients. And it's really been the best move that I could have made as a physician, just to meet all of the goals that I wanted with really taking care of people, having the time for them and aligning values, as we've probably talked about. And this is James.
Yeah, James Gaor. I'm a recovering emergency medicine physician, and now taking some primary care patients here in our practice. We met Carlos years ago in a basement at one of the earlier, DPC conferences when all of this was like, what are we doing? So it's been great to see all the growth and having this shared vision of really kind of democratizing healthcare for everybody, right? And we talk about access. And being able to focus in on the relationships with patients has really been the focus for both of our businesses. So it's been really great to partner with them, and it's been such a great tool for us to use. And we can talk more about specialty care, both e-consults as well as our in-person local networks that we've established over the years. But that's been really one of the top questions we get is, okay, what do I do about specialists, right? People ask about DPC. The 2 questions is, what do I use my insurance for? And what about specialty care? I think are the 2 biggest things that people who are interested in learning more about DPC ask us.
Yeah, and I think early on, the real thing, it's intimidating to start your own practice. And I felt so strongly that I wanted to provide so much value to our patients that, when you're a primary care doctor working in the corporate machine, you see a bunch of physicals and then all your patients end up in urgent care. And so there's a lot you don't get exposed to. And I think having my first year in the DPC and access to specialists without feeling like I'm, taking them out of their day or they're rushed, that I can really just send a formal consult in, really helped me expand my repertoire and made me a better primary care doctor and increase the value to the patients. So I think having that online consult, especially in the beginning of the practice, was really important. And then also, as you grow in the community and your practice evolves and you get to know the specialists you can call and who you can trust, then you have that access level too. So that helps.
Thank you, guys. I think the feeling is definitely mutual. We wouldn't be here if it wasn't because of you and the partnership, and broadly speaking, the DPC community. We have a care model that focuses around improving outcome for the patient and reducing total cost of care. And unfortunately, that doesn't matter for a ton of the providers out there doing fee for service. But we've been very lucky to be able to partner with you all from the early days. On that note about the care model and the relationship with the patients, one of the things that I've been most interested about over the last 18 months of the pandemic is how has COVID exposed the benefits and the limitations of some of the models. And what I've been hearing is that anyone who is doing value-based care or DPC was already at an advantage because your patients, you have enough medical history that you can do a lot of those things. You can keep providing the best possible care, even if you can't rely always in an in-person appointment. So, curious to hear some of the things that you've learned through COVID. What have been some of the best practices, or some things that are definitely here to stay, and or some of the things that you guys are going back to the pre-COVID days.
Yeah, to speak to that, and we had this conversation about how, and we've reflected on how, our practices and most DPC practices were already built for COVID, honestly. And so we talk about, focusing on communication, transparency. Most DPCs, when we set up, we were built for times like COVID, even though we didn't imagine COVID ever coming when all of this started. And it was very seamless. I mean, you take all the emotion and all the things going around when it came to patient care. It was easy for us to transition. We were messaging patients. Nobody was coming into the office, but we had phone visits, messaging, video visits. One thing that we did notice was actually people we didn't do a single video visit for years. It was open on day one for us. Nobody used it. And now it's just, it's so easy for we say, you want to do a video call? It's no questions asked, of course. But in the early days, nobody wanted to use it. And so it worked out perfectly for us. Our business has grown. I mean, we saw a lot of demand for patients just having access to ask us questions, right? And that's what we were here for. And being able to handle that was just real. We were very grateful for that, I guess.
I think we've heard too from a lot of our patients, and this is always what I say, the thing that I find so valuable in what we do is that trust with someone who knows you, that you have a relationship with, because the technology is so important too. And behind that has to be someone that you trust. So a lot of our patients could have had access to Teladoc or, anything else that's out there. And they were so grateful that they could reach us and trust us. They wanted all their family members with us. So I think that really underpins what to me is the most important value in what we do, is that relationship.
Wonderful. Now, switching gears a little bit, on your initial decision to partner with Rubicon MD to leverage e-consults to discuss cases with specialists, other than both of you being innovators willing to honestly to take a risk on a young and emerging technology, what were some of the things that more from the practice standpoint, like what were some of the reasons that led you to decide to implement e-consults?
I think for me, it was being able to expand my capacity as a primary care doctor. So there's two layers of it. One was for me, my own education. There are some things you just can't get on UpToDate, or that you really want someone else's opinion from. And you want it formally. And then the second was some patients just need that reassurance. Oh, well, the specialist agrees with what I'm saying. So sometimes just having that formal consult, and what I would do is put in the consult and then print it out and show it to the patient and review it with them and say, here's what the specialist is saying. And I think that can provide a lot of reassurance for people and save on cost for them and for the system.
Yeah, it was a patient experience thing for sure. That second point, I mean, in addition to the obvious clinical utility of it. From the patient's perspective, one of the things when we onboarded patients was, once again, going back to those first two questions, what do I use my insurance for and how do you deal with specialty care? That one was kind of easy. And we talked to patients like, hey, there's two methods, right? I mean, one is the traditional route. We can send you to specialists that we trust in the area if there's a question or a need, and clearly insurance can play a part in that if needed. But two is, if there's a quick question that we need to shoot to an endocrinologist about, here's a service that we can use and it can save you time and money. It's included in your membership fee in our practice, and it provides value once again to people who are in our practice.
Got it. That makes sense. So I assume from what you guys were saying that you are pretty transparent in terms of sharing with your patients that you are leveraging e-consults. How do you tell them? What do you tell them? We get this question all the time. Not all PCPs using e-consults are entrepreneurs like you guys, and maybe have that the same communication skill set. I hear from CMOs all the time. My clinicians love it, but they don't quite know how to communicate this to their patients. So very, very frequent question we get. What's the best practice in terms of communicating this to your patients?
I think, again, it comes back to that we have a trusted relationship with our patients. So if a problem comes up, I'm very transparent about what I have experience in and what I don't. So if I don't know the answer to something, I will tell them I don't know. I need to consult someone else for help. And there's a couple ways we can do it. One is we can go look for someone locally. I think this is something that we can handle with an online consult possibly, so we could start there. And I tell them that it's free, and then they're, well, why not? Why wouldn't we just do it? So oftentimes that's the case, that people just want to move forward with that because it's convenient to them, and it's easy, quick information.
Yeah, and I think, part of maybe in these bigger traditional settings that you're alluding to, I mean, the luxury of DPC is we have time. We don't feel pressured to rush off to the next visit. So having that conversation is just a natural part of our interaction.
Got it. What in terms of like the day-to-day, what are some of the most frequent use cases? What specialties, what conditions? Where do you find yourselves using this more frequently?
I find that peds ortho is a slam dunk for me, that when kids come in and they have broken bones, and most of the time it's like you splint and then do another x-ray and they move on, that you've really saved the parents a lot of trouble going to, waiting for a peds ortho visit. I had a patient who had a peds ortho visit, and then they told him to keep him in the boot forever, and the kid wanted to play sports, and he was pretty much better. And I was, 90% sure he could take the boot off a little early, but was able to get that consult back quickly to get them that information without them having to wait, another 2 weeks to get through where they couldn't. So I think that's a great one, because you can send them the x-rays and stuff. And so it's just really reassuring to me. And then derm is a really good one too. Just sending pictures of moles, and I've done some basal cells and melanoma excisions that I've done with the dermatologist through Rubicon to help me make sure that I'm doing it all right. And then, these procedure-based specialties like endo and rheumatology, that's really helpful because they oftentimes don't need to go. I mean, I can order labs and do a lot of the thought process that needs to happen there. So you really expand your capacity with the patient using that. So.
What she said.
Got it. Awesome. Maybe James or Emilie, can you guys give us a patient story, a consult, which was, I don't know, memorable, or one of your favorite ones because of what you learned or the impact that it had for the patient? We love getting the team and everyone inspired about the work that you all do, and would love to hear some of that.
I'm going to put Emilie on the spot, and she's going to hate me for this. So we're going to fight now. But we talked about this before, and she was really hesitant about talking about it. But this melanoma, she kind of flips it, throws it out there, this melanoma excision. It's actually my patient. So like she was saying, we're very transparent on what we do and what we don't do. I'm not skilled in dermatology procedures. And so Emilie does a lot of those types of things for my patients as well. And I had a patient who uninsured, very reluctant to see specialists, very reluctant about traditional medical care, but has been in our practice and has loved being in our practice, and clearly had a lesion that was a melanoma, and Emilie took care of it. And, her advice was, you need to have this taken care of by a dermatologist, and he was adamant that he would not go. And so Emilie can take it from there, but she basically took care of it with the Rubicon as well to assist in terms of making sure it was properly handled.
Right. I mean, there's no way I would have done that without that support. I think having the ability to send the actual pathologies and pictures, get reports back. Okay, here's how much you need to take off, and making sure that they didn't need any staging or anything as superficial spreading melanoma. So, we treated this guy's melanoma for like $150 with, the path reports, along with his membership with us, which, he would have spent thousands of dollars otherwise. So he was so grateful. And still he's doing great. I finally got him to see a dermatologist to go do a full skin check, and everything else is fine. So yeah, that was a good case.
Wow, that's wonderful to hear. And yes, I think most of the times we hear about the impact and the financial impact, but I think that that ability to enhance access to care, to your point, just hearing you say you finally got him to go see a dermatologist makes me think that had he not taken care of this, it would probably gone and treated, and who knows what negative consequences. Last question I have here for you guys. So DPC is sort of at the forefront of leading this transformation in primary care. Where do you see things going with specialty care? Obviously, a lot of things have changed with COVID. There's a lot more appetite for virtual specialty care, if you will. But where do you see things going in that interconnection between primary care and specialty care, which we know it's broken today?
Yeah, I would speak to that. I just actually got off the phone with a patient, and this is a good example because more and more people are underinsured, or they have a lot of cost upfront before they can access care. So this patient needs a nerve conduction study, and there's a neurologist out in Riverside here who will do it for a really reasonable cash price. And so we talked about, does she want to go through her insurance and see the neurologist, or does she just want to pay up front? And it was a very easy, no, I'm just going to pay up front. So we're seeing more of that, where specialists are coming up with more kind of direct pricing, more access in those ways, and our patients are taking advantage of it. We also have a general neurologist in our community who's starting to do more of a cash pay for a certain period of time. You pay kind of a membership for 6 months or so, and then she can manage you for that time. And the patients actually understand our model, and then they want to go with that model because they feel supported by it. So we see that happening. I don't know.
Yeah, it's not a new concept, right? In terms of direct pricing with specialists, it's the question of, when and if that traction is going to be big enough to really kind of scale, I guess is the bigger question. And at this point, at least, imminently, I mean, there's so many patients who are underinsured, like Emilie was saying, just because you have insurance doesn't mean there's no cost, associated with all these things. So there's an opportunity there. I think the fact that direct primary care has been around long enough now that we have a foothold and feel confident in how we can structure our businesses is an opportunity to partner with specialists. And I think it's a great time to help other physicians bring better care to patients at the end of the day, right? I mean, that's why we're all at these conferences and meeting with each other, is that common goal. And so, yeah, I invite people to brainstorm together to figure out how we can do better in that.
That's very interesting. And I think that my big takeaway from that comment is that you guys have already paved the way for that. You've built the trust with the patient so that they're now willing to do specialty care in a similar concept or construct. So kudos to you and the DPC community. Let me pause there. We promised that we would take questions from the audience, and then we're coming up on time. Should we, Mariel, should we take any questions from the audience?
Yes, absolutely. So one of the questions that has come in, and I think this is definitely pertinent to those practices who are starting out, or those physicians who are contemplating doing DPC. Did you guys open your clinic with Rubicon MD as a partner?
Yes. Yeah, it was awesome. Something we planned for. I know it's kind of a really anticlimactic. So but yeah, I mean, we thought about it. I mean, there's a couple services we really thought were important. That was one of them. We anticipated that being a question. And so we wanted to have that in background. We met with Carlos and it seemed like a no-brainer at the time. So yeah, we went with it.
Awesome. And in terms of when you work with a Rubicon doctor, when you do a consult, the way that it is formatted, if you have a question or a consult that you're bringing to the platform, can you follow up with that same physician after? If they give you a suggestion in the initial consult, you put that into action, and then you need follow-up for your patient?
Yes.
Yeah. In fact, I've done that years later, which I actually was surprised. Like, I think it'd been like a year or plus, and the same person responded like immediately. So that was a surprise to me.
It wasn't a bot.
So you're retaining people, I guess, Carlos. That's good.
You know what? The truth is that you guys are, and I think that's of everything we do, that's the most inspiring piece. When we connect with them, and these are top specialists who have a full practice and they're like a basic clinic, and they don't need to do this. Like their living does not depend on Rubicon MD, but they do it because they love it. They love supporting you guys. They are challenged and very excited of getting the questions, and it keeps them active and thinking. And that ability to have an impact in the community, providing their expertise, has been one of the reasons why we see almost no attrition to our specialist panel. Quite the opposite. We have many people reach out that they want to be part of it, but we have a medical networks team very demanding, and we want to make sure we're having the right dimensioning. But we should find more opportunities to do some of these panels with some of the specialists, because they love supporting the work you guys do.
Awesome. And Carlos, this is a question for you. When Emilie mentioned developing that relationship and having trust with our patients, when we as physicians choose to use a program like Rubicon, how does Rubicon vet the physicians who become consultants?
Yeah, it's as I was saying, we have a team dedicated to just that. They go through multiple layers. So everyone who becomes a Rubicon MD specialist, most of them we reach out to them. Like, we don't take too many inbounds. Most of them we find and reach out, and a lot of them is referrals from people that we trust. So they go through interviews with our clinical team. We interview them for, it's just the thing that's interesting. If you want to do e-consults, not only you need to be a great specialist, but you also need to be great at teaching and understanding the mission here, because this is not about telling a primary care clinician what to do. It's quite the opposite. It's about teaching and helping them learn more about your condition or your subspecialty or specific condition, so they are empowered to make their own decisions. So we've had excellent top 1% specialists who are not a fit. And they if you're going to send a one-liner with, do this, but that doesn't cut it for us. It's a very selective criteria to become part of it. Once they're on the platform, we will monitor. They get rated, their responses get rated by PCPs constantly, and we monitor that on a day-to-day basis. And any case that's not 4 or 5 stars out of 5 immediately goes through an audit for 2 reasons. One, we will proactively send it to another person to make sure that the PCP gets an awesome experience no matter what. But 2, we want to understand why this specialist is not providing 5-star responses. And so that's layer 2. And you could argue that that's more of a quality of service satisfaction type of rating. So we also wanted to have a 3rd layer, which is our peer-to-peer review process, where we will take responses within one specialty and have another specialist review them and rate them around, are these being educational? Are they following evidence-based guidelines? Are they being cost-effective? Because as we heard, it matters a lot for anyone who's in value-based care or anyone who's doing DPC and pairing that with a high deductible plan. So somebody actually pointed out that there's a level of review that actually doesn't happen in physical care. You go see an endocrinologist and no one's going to go back and review the recommendation. And we actually are able to do that in eConsult. So yeah, it's a highly curated network. And I think it only works because we also have excellent primary care clinicians on the other side, asking them questions that keep them on their toes and gets them excited.
Great. And you talked about how, it would be wonderful for the consultants to do more education on the public side. And I've personally attended Rubicon's educational sessions, even sessions that were focused on COVID. So can you touch on those educational sessions, and do you have to be a Rubicon MD user to attend?
Most of them you do. Like we'll do monthly. We'll just pick a topic that is generally suggested by our PCP community or frequently asked question, and we'll do a CME session on it. The education point was very important for us, and we got the accreditation from the AAFP to offer CME for e-consultant for the sessions. In some cases, like when COVID hit. Or when we think that there is a lot of opportunity or benefit for the community, we'll just open them up and make them publicly available by everyone. Specialists love doing them. The team loves hosting them. So, definitely more to come on that front.
Wonderful. And Emilie and James, this question is for you guys. In terms of, you opened with Rubicon, and your patients obviously have trust in you because you've been open almost 6 years now. I want to ask about growth because you guys are in Irvine, where there's a lot of specialists available, not necessarily accessible in terms of time to next visit. But have you seen patients join your practice because you offer Rubicon as part of your services?
It's a good question. Not necessarily as a primary reason, like, I guess specialists, they're coming for care, I guess, right? So I guess as a general statement of access is very common, right? I can't see my family doctor, or the next appointment for X, Y, and Z is not for 2 months from now. So as a general statement, it is a time of access has been an issue for a lot of patients who have joined our practice.
Yeah, no, I think it's more about retention than it is about recruitment.
Yeah, for sure.
Awesome. Well, thank you guys so much. That's all the time we have today. And if you do have more questions, please feel free to reach out to Dr. Scott, Dr. Gaor, as well as Carlos after this session.
Thanks, guys.
Thank you.
Thanks for having us.